The U.S. Commission on Civil Rights Northern Marianas Advisory Committee has been meeting for months to decide its core focus for investigation.
We then voted to investigate the topic of access to adequate health care for incarcerated individuals within the Northern Mariana Islands justice system.
The committee's first in-person briefing on Friday featured panels of attorneys, healthcare providers, and government officials for a full day of testimony. The first panel included impacted individuals like Godfrey Mendiola, who sued the Department of Corrections for inadequate medical care and inhumane prison conditions starting in 2018.
I was put in a very dirty, unsanitary condition place. No running water in the cell. I contracted bacteria that I couldn't even walk. It took me 8 months to finally get my medication after the doctor ordered 6 months earlier. So somehow the blaming game started with DOC medical staff.
Chief of Parole Nick Regis hesitated to confirm the allegations but recognized the circumstances at the prison after working in the field for over 2 decades.
I don't want to say he's right, but a lot of things, when I started, I see those things happening in corrections. You send in a medical slip, they'll dump it in the trash. It doesn't go forward. That's how poor it is.
Regis brought Alfred Aldan to the panel, who he says has been on parole for 17 years.
For my experiences, I too, would wait probably a week just to get a checkup for my tooth, and they will not fix my teeth, they will just extract. Because the rule is there's no money. There's always no money for us, individuals. We would see the doctor depending if the doctor is in or not. Sometimes the doctor will come in once a week. We had nurses, but the nurses were gone, not for long, maybe 2-3 months, and then they're gone because they can't afford it. It's always about money.
Corrections Commissioner Anthony Torres, who took office in March, says the department under his leadership will take responsibility and create programs aimed at rehabilitation and reintegration.
Currently, the medical unit utilizes a triage form through which all detainees and inmates, including juveniles, females, and federal ICE detainees, can report their health concerns. All inmates and detainees are given instructions regarding requesting care by the classification unit, and the juvenile officers educate the juveniles. An illness, injury, symptom, or condition of a serious nature receive immediate, expedited attention with referral to the CHCC emergency room. Other non-urgent health problems are addressed via the triage form generally within 15 minutes of being received at the medical unit and acted upon with regards to the nature of the content.
DOC currently has 1 medical doctor who is at the prison for 40 hours a week and 3 trained officers in the medical unit. They also have 3 mental health counselors. While the legislature has provided funding for 3 nurses, recruitment is an issue. In a separate panel, healthcare officials responded to the committee's question of what support they need to improve the system.
We first need to assess the need for the incarcerated because there's such a wide range of spectrum of care that we're looking at. And if we know where the greatest need is, then I think that's where we can focus our workforce development and just kind of answer that need. But beforehand, it's really difficult to do it with a blind eye or a blind shot. But for now, we've just been working with what's most medically necessary.
The committee will put together a report based on those testimonies, which they will forward to the U.S. Commission. Thomas Manglona, KUAM News, Saipan.